Cosmetic dentistry, some people think it's only about a beautiful smile. A lot of times it's restoring function. And what function is actually be able to bite food. And if teeth are worn down to the point where you're over closing, you don't see your front teeth at all. Think about somebody that when they smile, all you see is their lip and not teeth. So cosmetic dentistry builds back the function of the bite and ultimately creates a cosmetic outcome in that way. Cosmetic dentistry is interesting. It could be as simple as whitening or fixing a gummy smile, but it also could be somebody who just won't smile when they come in for the first visit because they don't like the appearance of their smile. 9 times out of 10, that can be fixed with whether it's maybe somebody has old bridges or crowns in the front that show metal or a gray line of the gum line or a gummy smile. Either way, it all can be resolved with cosmetic dentistry, and sometimes it's same day completion to where then people come back and smile all the time when they come in and see you. Anybody's a good candidate for cosmetic dentistry. It's more identifying that. So if you're someone that feels like they just don't like their smile or the way they look in a picture, call West County Dental, call my office, Dr. Pete Spalitto, and set up for a consult to where we could kind of address what your concerns are. A lot of the cosmetic results that are most popular in my office at West County Dental tend to be veneers and crowns and whitening with a laser, whitening with trays, getting rid of old fillings that are silver and replacing them with tooth-colored fillings. Or maybe you have an old crown that you can see the edge of in the front in a picture. Those are the most basic cosmetic fixes. One of the easiest ways of helping people with their cosmetic goals is taking pictures and sitting in my office with them and showing them things that I see and then letting them point out what they see, and we try to meet in the middle and kind of figure out a plan together what will work best for them. What I find with cosmetic dentistry is that it does ultimately increase confidence, a smile that they didn't have before. Maybe hanging out with friends and family a little bit more and not kind of putting their hand over their mouth or smiling more in pictures. I have people ask all the time, is it worth at my age, whether you're young or old, to invest in cosmetic dentistry? And I say absolutely, and here's the reason is that if you're asking that question, then you definitely have a lack of confidence in your smile for one reason or another. By coming into West County Dental, Dr. Pete Spalitto is who I am, and asking and going through this process together, I think you're going to find that it's easier than what you think it is. With cosmetic dentistry, what I hope for folks is a long-term fix, not just a short-term fix. And that's how I take care of my patients, is more of a complete look over of everything, and how would I want it done on myself or a family member, and how it will last for a lifetime is what we hope. The only way to experience it is to come in, talk with me at West County Dental, to where we can actually sit down and talk about your goals, your needs, and what investment you want to put into yourself. And I think what you'll find in the end is that it's easier to attain than what you think. One of the fun parts of the cosmetic dentistry aftermath that I enjoy more than anything is the comeback. Someone comes back afterwards and they're smiling when they walk in. They're not sore. They realize it was easier to get done than what they anticipated. They're telling their friends, their family about their experience, talking to our whole office on how happy they are. That's the fulfillment part of it for us, is that someone's happy and not unhappy. They came in unhappy originally, and they're leaving, just smiling from ear to ear, and they're functioning better than when they walked in. Something that I feel like that separates me from other folks out there, and I'll talk about myself, is that I'm really big on phone calls afterwards and seeing how someone's doing. If they have discomfort, how can I help them? Typically, people don't have discomfort, but I like to follow up and ask that. It makes me feel better that they're doing well. Also, we have them usually back about a week later or so for a follow-up visit, just to check things out, see if there's anything I could answer for them or help them out with. I feel like if I was going through that myself, I'd want that done for me, and that's how I try to treat everybody.